This is a project by Chelsea Norris for Colorado Christian University on counselor identity and my own personal development during the last few months. Developing a personal identity as a counselor is important for several reasons. The key reason being that there is an ethical responsibility to the client to know yourself and have a foundation from which to work. This is critical in order to have techniques and a counseling process that can be clearly defined for the client. Being able to outline the counseling process can assure informed consent and assure a good fit, which can reduce the risk of harm. Developing identity involves knowing yourself. Each individual should be aware of their personal belief system, what gives their life meaning, and understand their worldview. Defining truth, what is right, and basics of human behavior are just a few things one must accomplish in order to begin to understand oneself. On the path to developing counselor identity, it is valuable to begin by developing one's own viewpoint. Defining humanity, treatment, psychopathology, and health will give a counselor a foundation from which to work. Once a viewpoint is clearly defined, research on the theories available to counselors in this resource-rich time in history can begin. Counselors also need to consider the population they will be working with, and if their chosen method is appropriate and efficient with this population group. In discovering and defining these things for my own life, I began with my target population. I have known since I was young that I have wanted to work with children, and entered this program at CCU with the goal of working with young traumatized children. I knew some of my values immediately. I wanted to treat the whole child. I appreciate humor, and God is the center of my life, and this is unchanging no matter my setting. I will be exploring the spiritual when applicable, praying for my clients while letting the Spirit lead my sessions, and I truly believe in living out 1 Corinthians 9:20. To the Jews I became a Jew in order to win the Jews. To those under the law I became as one under the law, though not being myself under the law, that I might win those under the law. I also believe God is our source and should be the one we go to for guidance and morals. I believe that we are social beings and that our pathology is external and internal and can come from protective mechanisms as well as biological factors. I look at treatment as something that should be genuine, collaborative, active, creative, and avoiding limits and advice as much as possible, and that children need empowerment, self-exploration, and a healing space. My path to theoretical orientation has been unique, as my research involves going a step further to understanding specific methods of play therapies. I entered CCU knowing that I want to practice play therapy and eye movement desensitization and reprocessing, EMDR, with young children. EMDR is a behavioral approach, which is not a foundation I want to practice from. This means I will be practicing an integrative approach and plan to use my practicum as a guide. During this time, I will work closely with my supervisor and follow Corey's advice to remain open and selectively incorporate a framework for counseling that is consistent with my personality and my belief system. Since behavior therapy is not in line with my personality, I began to research play therapy techniques. I first discovered child-centered play therapy, which was discovered by Virginia Axel and is rooted in person-centered therapy. This method of play therapy has been in practice for over 50 years with almost no modifications. I agree with most of child-centered therapy's premises and goals. However, I disagree with their definition of pathology, and according to Virginia Axel's tenets of child-centered play therapy, practicing EMDR would not be allowed in my sessions. Gestalt play therapy is rooted in Gestalt therapy, which was developed by Frederick and Laura Perls. This method utilizes experiments, creativity, and aligns with most of my beliefs and values. I am particularly drawn to Gestalt play therapy's description of children's behavior, having worked out of this belief for years. I do not align with the premise of a non-moral good, however, though this premise may be adaptable. I have had the goal of receiving an EMDR certificate since before entering the CCU program. This is due to my own personal success with the method, recent research on the benefits of this method on type 1 traumas, and my belief that research will prove it is also effective with other traumas as well. Many play therapists are beginning to utilize EMDR as another tool in their sessions, and I plan on doing so as well. However, as EMDR is a behavioral method of counseling, I will only utilize it as a technique and not a foundation for my practice. Being unsure of which method of play therapy to choose, I turned to the Theory Sorter Revised, found in Halber and Halber's Developing Theoretical Orientation in Counseling and Psychology. Once complete, it was apparent that I leaned towards Gestalt therapy, as I scored highest in that method with 15 points. My second highest method, however, was a 5-way tie, which included person-centered therapy. The other 4 therapies were analytic, reality, cognitive behavioral, and family theories. Having so many theories in second place with 8 points, I decided I should further investigate and sort through them. Analytic theory has the holistic approach I am looking for. This approach is also creative, genuine, and takes into account the whole lifespan. However, this theory pushes towards individuation and works towards the emergence of the psyche. Overall, it's not a therapy I am looking into. I was surprised to see reality therapies score so highly on my inventory, as I disliked the goal and techniques of the therapy so deeply during my research. I see this as a selfish therapy, and I only align with the premise that we need meaningful relationships in our life. I discounted this therapy as well. I was not surprised to see cognitive behavioral therapy on this list, as I have been using techniques from this method in my work the last few years. I do believe that this method is effective in changing behaviors and thinking, but I struggle with the fundamental belief that cognitive behavioral therapy ascribes to, that insight is unnecessary for change. I also struggle with the fact that it is a behavior modification therapy, when there are so many other issues that clients need to address. I believe that CBT is best used as a set of techniques with another method of therapy as a primary framework. I also do not want to use this method of therapy on young children. In my research, I had not included family theories. I had left this out as I plan on working with individual children. Seeing this group of theories score so high on my inventory, however, reminded me that working with children means working with the whole family. Corey states that the development and behavior of one family member is inextricably interconnected with others in the family. This means that I will be integrating pieces from this area into my practice. More specifically, I will use multi-generational family therapy to look for and work towards breaking unhealthy cycles, and utilizing human validation process model to help families work towards congruent communication. Utilizing an integrative approach is a great responsibility, and having never been in a session, I am still searching for a framework from which to practice. However, I do believe it will end up being Gestalt play therapy. Along with this, I will utilize EMDR and family theories to help my clients achieve healing. In this process, I will lean heavily on my peers, supervisors, and teachers to guide me. This guidance will be crucial to help me integrate these techniques efficiently in my sessions.